Good afternoon. I am nursing student Carrie Branch and I will be administering medication to a patient. The name of the medication I will be administering is Vasotec. The doctor has ordered 20 milligrams of Vasotec post oral OD, meaning through her mouth one time daily, and that time is 10 a.m. Okay, so I have checked the patient chart, and prior to this video I have tested her blood pressure because Vasotec is a hypertensive medication, so it treats high blood pressure. So I've made sure that her blood pressure is high before I gave her this, so that if I gave it to her, it wouldn't go too low and she wouldn't die. Because, if you're giving high blood pressure medication, you have to make sure the pressure is high, because if it's not and it's low and you try to make it lower, the patient will die. Okay, now I will be preparing my drug tray. This is what the pharmacy sent, Vasotec 20 milligrams, and I have checked the medication order twice. I will now take out. So I've taken out the medication. The pharmacy sent up 20 mg, so there's no calculation really needed. There is one pill. They want 20 mg. We have 20 mg in a pill. So now we will meet the patient. The chart says that her name is Shalicia Coakley, and she was born on July 14th, 1999. Now, before we meet the patient, I will practice medical hand washing before I distribute the medication. Okay, let's go. Good afternoon. Good morning, ma'am. Could you please state your name and date of birth for me?
Good morning, my name is Jaleesa Coakley. My date of birth is July 14th, 1999.
Okay. Well, today I will be giving you Vasotec. Okay. It's a hypertensive medication, means it treats high blood pressure. Some of the side effects may include diarrhea, rash, nausea, vomiting, hypotension, which is low blood pressure, and fatigue. Secondly, when you take this medication, you cannot discontinue it suddenly, and when standing up, you go from sitting to standing slowly. Don't do that quickly. Okay. Do you still want to take this medication? Okay.
Are you still in the roommate? Did my mommy call you? My mommy.
Where's she?
Did she call you?
Hi. Good morning. This is Nurse Branch again, and I just administered Vasotec, and after I administered Vasotec, I documented, then I washed my hands. So my hands are now clean. Now the doctor has ordered 300 megagrams of Plavix stat, and since Plavix is a blood thinner, I have checked her platelet count for thrombocytopenia, and her platelet counts are normal. so I can go ahead and give her the medication. Because Plavix is a blood thinner and it helps to prevent stroke and myocardial infarctions, and those things deal with, blood clots. We don't want the platelet count to be low, and then we make it lower by giving her blood thinner. So since her platelet count is normal, we can go ahead and give her that. Now, as I stated, I've already washed my hands, so my hands are clean. The pharmacy sent up 150 milligrams of Plavix, so I will have to give her two tablets to get the 300 that the doctor ordered, because he wants 150 and he wants 300 and we have 150. So we have to do that math, and that will be equal to 2. Okay, now before I meet the patient, I will wash my hands. Okay. The patient's name is Jalicia Coakley, and she was born on the 14th of July, 1999. I will be confirming this when I speak to her to make sure that it's the right patient before I administer the medication. Okay. Good morning. Could you please state your name and date of birth for me?
My name is Jalecia Coakley. My date of birth is July 14th, 1999.
Okay. Now, I've come to administer to you Plavix. Now, the side effects may be bleeding, weakness, diarrhea, vomiting, and rash. And when you take this medication, you have to inform the doctor. If he tries to prescribe a new medication, you have to inform him that you're already on this one, and you have to, if you're going into surgery, you have to alert them, because this is a blood thinner, and if you take it before surgery, you can bleed out and die.
Okay.
Do you still want to take this medication?
Yes, ma'am.
Okay. Now that the patient has taken the medication, I can now document by signing my name under 10 o'clock KB NSTD on the 14th of October 2020. So I'm going to document that right now, and I will wash my hands. Thank you.